Hi, my name is Christelle Ashkar. I'm an attending in epilepsy and neurogenetics at Boston Children's Hospital. And I have had the wonderful pleasure of working with the SCN8A Alliance on this much needed project to look into areas of consensus in the management, diagnosis, and expectations in SCN8A. And I think that the Alliance has done a fantastic job pulling all of the specialists and these informations together. I will be talking about the clinical features associated with SCN8A. In addition to what has been discussed before in terms of epilepsy and seizures, meaning that these were 17 areas that were found across all five phenotypes, and there were 5 of them that were quite common clinical features across all 5 phenotypes. And we will go through more details. But in addition to looking at those particular features, the data was supplemented by information retrospectively collected regarding those clinical features, whether they are present or absent in the subgroup of patients who have gain of function variance and the other subgroup of patients who have loss of function variance. Finally, I will be reviewing our consensus on the prognosis for the epilepsy and the development, depending on the phenotype. The 17 clinical features here are divided under those 3 rubrics. The first one is really the neurological features, and these have featured fine and gross motor delays, different types of movement disorders, tone abnormalities, mainly hypotonia, cortical blindness or cortical visual impairment, autonomic abnormalities, sleep disturbances, and increased SUDEP risk. Under the rubric of development, the main clinical features were communication delays, intellectual disability, behavioral, emotional dysregulation, and more formal autism spectrum disorder. Slightly outside of the neurological realm and the developmental realm, looking at the rest of the organ systems, there were additional clinical features that were found to be and believed to be present in several of the phenotypes, and these included orthopedic problems, gastrointestinal or GI abnormalities, feeding difficulties, as well as respiratory pulmonary issues. A couple of highlights that I'd like to add here that are quite important from those findings is that the highest consensus that was found, and also backed by experience, was in the area of the severe DEE phenotype. It is also important to highlight that the highest consensus occurred in the area of severe DEE, where the respondents believed that all 17 clinical features occurred, and 15 of those features occurred in a very severe form. There was a large consensus that in the severe DEE, none of these features are expected to improve or resolve. There were 5 most frequently occurring clinical features across all 5 phenotypes that were agreed upon, and these included communication, fine motor skills, intellectual disability, as well as sleep and behavioral dysregulation. What we are looking at here is the percentage of respondents who believe that each of these clinical features occurs in at least half of the time in each of the specific phenotype. So going through each phenotype and giving some examples, you can see that in severe developmental epileptic encephalopathy, there is a rather large consensus where pretty much all involved respondents said that there are speech disturbances, fine motor skills, intellectual disability, and sleep disturbances. Behavioral challenges was still commonly agreed upon, although not as much as the other features. Moving to the phenotype of self-limited familial or non-familial infantile epilepsy, you can see that there is definitely fewer respondents comparatively to the severe DEE. This really leads us to learn that we need a lot more research in these particular areas. To go to another example, which is the neurodevelopmental disorders with epilepsy, one of the 5 phenotypes. Of course, all 5 areas are present, but you can also see that there were less respondents that actually reported that they believe it occurs in at least half of the time in that particular specific phenotype. And then I think it is important to look at the neurodevelopmental disorders without epilepsy, where there is more or less of a consensus in the areas of behavioral challenges, speech, fine motor skills, and intellectual disability, but not so much in the area of sleep disturbances. These are also features that are not very well reported in the literature. And so I think this is really showing us that while we do have consensus in some of the phenotypes, we really still have some work to do in the others. In addition to the consensus findings, those 17 areas were looked at in the 2 subgroups of patients with SCN8A, the gain of function and the loss of function subgroup. As you can see, seizures was found to be very common in the gain of function patients, but also hypotonia, sleep difficulties, GI difficulties, movement disorders, feeding problems, and the same applies really to the loss of function SCN8A, where several of these 17 clinical features were also found. Delayed speech was very common, as well as different forms of intellectual disability, developmental delay, autism spectrum disorder, behavioral abnormalities, even movement disorders, which is less represented here than in the gain of function SCN8. And finally, we looked into what we believe the prognosis for either the epilepsy or the development is for all of these subtypes or subphenotypes of SCN8A. And what we're showing here really is the degree of or the strength of the consensus that was found from all of the respondents. And to go through it one by one, when we talk about the seizures or the epilepsy itself, under severe DEE, there were really no respondents that said that there was going to be significant improvements, but there were the rest of the respondents were split between the possibility of modest improvement, some limited change, modest deterioration, or severe deterioration. While on the other hand, when we looked at the moderate or mild to moderate developmental encephalopathy, there was more of a consensus that there is at least modest improvement, if not significant improvement. In the self-limited infantile epilepsy, again, more consensus about significant improvement. Same for the neurodevelopmental disorders with epilepsy. And then again, with the last column does not apply, given that in these patients, we do not expect to see epilepsy. And moving on to the next part of the table, regarding the development. In the area of severe developmental epileptic encephalopathy, there was quite a bit of a consensus that there was no significant improvement or modest improvement. However, the respondents ranged between anywhere from the possibility of severe deterioration to some limited change or limited improvement.